Hi, my name is Jennifer Smith, and I'll be talking to you today about my philosophy on healthcare and nursing. I have been a nurse for 23 years now. Time has gone by very quickly, and I have definitely learned a lot over the years. I spent about 15 years working in intensive care, and then have spent the rest of my time working in hospice. I think that caring is central to nursing. I chose nursing as my profession because of my desire to help those in need. When reading the nursing code of ethics that we got for our class this term, I really connected kind of with all of the provisions in there, but especially provision 1. The nurse in all professional relationships practices with compassion and respect for the inherent dignity, worth, and uniqueness of every individual, unrestricted by considerations of social and economic status, personal attributes, or the nature of health problems. The need for health care is a universal, transcending all individual differences. I think that establishing those relationships and with respect for human needs and values without prejudice for one's individual lifestyles, value, and religious beliefs is definitely an important consideration. I found this diagram of the dynamic nursing care model. I think it really shows a good picture of putting the patient and family as central, and everybody kind of works around them, the healthcare team and the community, and involves teamwork, innovation, respect, integrity, commitment, compassion. I know that I feel like I've really used this model a lot in my practice as a hospice nurse, because we definitely have a healthcare team of the nurse, the doctor, the social worker, and chaplain, and we reach out into the community and taking care of people in their homes, and definitely have to come up with unique individualized care plans, and I think when dealing with patients in their home especially, respect is definitely an important part of the model. If you show them respect and treat them as an individual, and that you care about them, have compassion for them, and that they will really, it helps to break down those barriers with communication, and they will be more open with you and willing to share things, and it just helps everything go smoother. When thinking about my philosophy of healthcare, these are a few questions that I came up with that helps me think about it better. Who requires and/or deserves healthcare? I mean, I think I feel like it's a fundamental right of all people to get health care. It doesn't matter if you're rich, poor, or any race, whatever. Everybody should have same access to health care. It shouldn't be based on how much money that you have or where you live. It's definitely, obviously, a challenge to provide that. How can it be best administered to the greatest number of people? Well, I know that they're still working on that. There's no real good answer for that right now, but hopefully there will be someday. I know that I feel thankful to work for an organization right now that seems to have their core values in line with mine. You know, their mission is to serve the poor and vulnerable, and they provide a lot of charity care, and they don't deny services to anyone who can't pay for them, especially for hospice services. If they do not have insurance or cannot pay, they still can come onto hospice, and they will cover their costs, which is nice.